The World Health Organization is predicting a 77% jump in cancer cases by 2050 and a big jump in cancer deaths as well. We're going to look at what they are saying the cause is and some other potential causes that they dare not show. Let's look at the most popular increasing kinds of cancer as well. So, the World Health Organization put out this advisory: global cancer burden growing amidst mounting need for services. It says that the number one cancer right now is lung cancer. Number two, female breast cancer, followed by colorectal cancer, prostate cancer, and stomach cancer. Now, let's look at what they say the cause is as they project a giant jump in cancer by 2050. They said here over 35 million new cancer cases are predicted in 2050, a 77% increase from the estimated 20 million cases in 2022. The rapidly growing global cancer burden reflects both population aging and growth, as well as changes to people's exposure to risk factors, several of which are associated with socioeconomic development. Tobacco, alcohol, and obesity are key factors behind the increased incidence of cancer, with air pollution still a key driver of environmental risk factors. In terms of absolute burden, the high HDI, that is the Human Development Index. So high HDI countries are like the United States and Europe. They're expected to experience the greatest absolute increase in incidence, with an additional 4.8 million new cases predicted in 2050 compared to 2022. Yet the proportional increase in incidence is most striking in low HDI countries such as African countries. 142% increase in cancer they're projecting in places like Africa. Likewise, cancer mortality in these countries is projected to almost double in 2050. Wow, that's crazy. There's also reports from CNN reporting that cancer incidence is rising among young adults, and it's baffling scientists as to why more young people are catching cancer or developing cancer. Cancer incidence, they report, rising among adults under 50. New report says, leaving doctors searching for answers, featuring a 34-year-old man with cancer there. It says cancer patients are increasingly shifting from older and middle-aged individuals, according to a report released Wednesday by the American Cancer Society. Among adults 65 and older, adults 50 to 64, and those younger than 50, people aged younger than 50 were the only one of these three groups to experience an increase in overall cancer incidence. Even though the overall U.S. population is aging, we're seeing a movement of cancer diagnosis into younger folks, despite the fact that there are more people that are in the older population, they report. So cancer diagnoses are shifting earlier, he said, and there's something going on here, but they just don't know what is going on. I don't know if you guys saw the tweet from the FDA commissioner. Here it is. Dr. Robert Califf tweeted a few months ago, quote, "We are facing extraordinary headwinds in our public health with a major decline in life expectancy. The major decline in the US is not just a trend, it is described as catastrophic." We're going to look at what the actual causes of more younger people dying are. Really quick shout out to the sponsor of my coverage, which is National Gold Group. Gold has soared past 2,100 at the end of 2023, and Donald Trump recently warned that the U.S. dollar no longer being the world standard will be our greatest defeat in 200 years. Military conflicts in Israel and Ukraine and Yemen, plus rate cuts on the table, are fueling gold's meteoric rise. Several major banks are all forecasting sizable rate cuts in an election year. Some say this is Biden's Hail Mary attempt at keeping the White House. Meanwhile, our national debt is skyrocketing. Now, there's a direct correlation to the national debt and the price of gold. In 2020, the U.S. debt was $23 trillion and gold was $1,500 an ounce. Now, in this past year, debt was $33 trillion and gold soared over $2,000 an ounce. So why are so many Americans adding physical gold and silver to their portfolio and retirement plans? You can learn why. Call America's own precious metals company. The National Gold Group today mentioned my channel, Ivory Hecker, and you'll always get best-in-class service from America's conservative precious metals leader. National Gold Group has the IRA fee waiver on all qualifying rollovers. Call 888-617-5927. Get a free investor guide. National Gold Group is a Consumer Affairs top-rated gold IRA dealer. 888-617-5927. That number down in my description. Remember, there's always a risk of loss, and past performance is not indicative of future results. Okay, so let's talk about the FDA commissioner brainstorming on what can be causing so many people to die younger. He was tweeting that JAMA International Medicine published earlier in November that our overall life expectancy has dropped to 76 years old. And remarkably, that male life expectancy in the US has dropped to 73 years old. That means a ton more young people are dying, causing the decline in the life expectancy. Now, he's unsure why this is happening, but he tweeted, each year, more than 1 million Americans die from diet-related diseases, including cardiovascular, diabetes, and certain forms of cancer. We've seen enormous progress in treating these. He also tweets that a lot of people die of tobacco. So he's brainstorming, maybe it's tobacco, maybe it's these cancers and things, which the WHO also mentions tobacco use as to why more people are getting cancer. But tobacco has always been an issue, and why we're suddenly seeing this jump is questionable. Now, what they don't want to talk about at all is all these recent incidents of rapidly developing cancer. I'm going to say it that way. Rapidly developing cancer and people suddenly dying. A friend of mine died of rapidly developing cancer just a few months ago, and it's affecting a lot of people. And there have been reports, is this associated with new pharmaceuticals that everyone took in the aftermath of the pandemic? The fact checkers are circling the wagons on that. But let's look at the research of the Florida Surgeon General. Last month, the Surgeon General of Florida, Joseph Ladapo, put out an advisory calling for the halt of use of this new pharmaceutical, let's call it the Fauci ouchie, in the arm. He's calling for a halt to that after his own Surgeon General's office researched this new technology and found concerns, brought the concerns to the FDA, and the FDA didn't have answers for them. So he put out this advisory. Now, he wrote in his advisory that he reached out, he wrote a letter to the FDA, actually to the same Robert Califf, who's wondering why people are dying. He wrote a letter to that commissioner of the FDA in December saying, hey, we've noticed some DNA fragments. Actually, there's billions of DNA fragments per dose of the Fauci ouchie. Now, do you have information on safety associated with these DNA fragments? He's writing this letter saying, here's the thing, the lipid nanoparticles that are in these Fauci ouchies are very good at delivering whatever ingredients are in that thing into your cells. So when we're identifying billions of DNA fragments per dose, we need to understand that those are mixed with lipid nanoparticles, meaning DNA fragments are going to be delivered right into the cell. And that's a concern for your health. Now, he said, has the FDA done any research on whether this is impacting people's health in a negative way? These random fragments, because he brought to the FDA the fact that in 2007, the FDA published guidance on regulatory limits for DNA needles in the arm. And they said, when it comes to this new DNA research, when you're sticking needles in the arm that are delivering DNA, you need to be concerned about a few things. And here's a key bullet point. DNA integration could theoretically impact the human oncogenes, the genes which can transform a healthy cell into a cancerous cell. Okay, you lipid nanoparticle deliver trace DNA fragments right into your healthy cells. It can turn healthy cells cancerous, is what their research in 2007 was indicating. And that, so he brings this to the FDA. On December 14th, FDA writes back to him and provided no evidence that DNA integration assessments have been conducted to address risk factors outlined by the FDA themselves in 2007. So, based on the FDA's recognition of unique risks posed by DNA integration, the efficacy of these Fauci ouchies and their delivery system, and the presence of DNA fragments in these Fauci ouchies, it is essential to human health to assess the risks of the contaminant DNA integration into human DNA. The FDA has provided no evidence that these risks have been assessed to ensure safety. As such, the Florida Surgeon General, Dr. Joseph Ladapo, has released his statement. They said so. That's why he's calling for a halt, because they're not getting answers on whether it has been studied. The potential for cancer has been studied in these new pharmaceuticals. And isn't it coincidental that suddenly we're hearing from loved ones left and right that they're developing cancer? But when anyone tries to report on this online, they get shut down. I have this USA Today article doing a fact check saying US government hasn't reported a surge in cancer amongst people who took the Fauci ouchie. So it's basically state-run media today. Even though the our free press in America still thinks they're a free press, all they do is parrot whatever press release the federal government puts out, rather than looking into what the Florida Surgeon General just advised. The fact that trace DNA going into your cells can jack up a healthy cell and cause cancer. But they wrote here, USA Today wrote, there is no mention of a link between the Fauci ouchie and a surge in cancer cases anywhere in the CDC's website. Therefore, it doesn't exist if the CDC says it doesn't exist. They go on to say, instead, it describes the Fauci ouchie as safe and effective. Oh, I guess it is then. And it states they've been evaluated in tens of thousands of clinical trial participants. The American Cancer Society estimates the number of new cancer cases and deaths expected each year. They have to do estimate projections each year because actual data can lag 2 to 4 years behind the current year. The CDC's data, for instance, is only available through 2020. Why is CDC taking so long to update the cancer data? World Health Org has data through 2022, but CDC won't let us know how much cancer has increased since the pandemic. I wonder why. But the USA Today says the reports show. So all they can do is projections. What American Cancer Society thinks will happen with cancer, and they're reporting that the reports show nearly identical estimates for new cases and deaths for 2022 and 2023. About 1.9 million expected new cases and the same amount of deaths. So therefore, it's not true because the American Cancer Society is not projecting a jump in cancer. Therefore, there's no jump in cancer, even though we don't have real data from the CDC, who's not letting us know if there's a jump in cancer. All we know is that we have people that we know who are dying of escalated cancer, and we're not sure. We're not sure why. We're suddenly hearing a lot of this. Oh, I wanted to also show you guys this. Let's see what I can put on the screen and what I can't. Okay, don't want any trigger words on the screen. NBC also shared this. The same FDA commissioner who's racking his head about why so many people are dying. He says that part of the reason younger people are dying is health misinformation is lowering U.S. life expectancy. He said in an interview with CNBC, Dr. Robert Califf said better regulation is needed to combat health misinformation that's rampant online. So if you can only see what the FDA wants you to see, you'll live longer, they're saying. Just trust the government, put your blinders on. Now, it's really interesting. The Epoch Times, who I love, they have put out an article with headline multiple Chinese scientists die. I can't word everything correctly on YouTube, but you guys may have seen the podcast I did a week or two ago with Elizabeth Lane, where we talk about how all these epidemiologists, these scientists who were working on pharmaceuticals, working on certain kinds of plagues, were dropping dead. Well, there's a new article out from the Epoch Times of a list. Now, the list I did was American scientists. This is a list of Chinese scientists who just dropped dead just recently. It says on October 1st, 2023, Cao Qiaobin, a senior manager at the Sinovac biotech company, died at the age of 45 years old. So he was developing the Fauci, and he dies way early. I looked it up. It said he died of rapid cancer. On October 27th of 2023, Wu Zunyou, a chief scientist of the Chinese Center for Disease Control and Prevention, died at the age of 60. I looked it up. He also died of rapid cancer. On October of 2022, Wu Jingyou, a scientist who deals with plagues at Wuhan University, died at the age of 66. I think he had a heart attack. A couple of these guys had heart attacks. A couple of these guys had cancer. Other deceased scientists included a Fauci researcher. Zhao Zhendong died at 53. Zhen Bing died at 52. Lu Bin dies at 37 years old. He gets murdered. And nucleic acid testing researcher Bai Xiaoyin died at 42 years old. So it's kind of weird, all these people dying just in 2 years' time who were very closely associated with this new Fauci research. Among the experts include Zhou Yusen. He was a Fauci expert at the Academy of Military Medical Sciences, who was among the first to apply for a Fauci patent, but died suddenly a few months later. Now, not all of these scientists' cause of deaths are available. Some of them, it just says they had a brief illness and died. So it's a little bit strange, but it's interesting that a few of them also had this rapid cancer. You would, that if they're researching this sort of technology, they believe in it, they probably took the ouchie themselves. You guys may have seen the headline today that a rare case of human plague was identified in Oregon, likely spread by a pet cat, health officials say. CNN reporting this. I think it's a big nothing, but this is the bubonic plague that killed so many people in Europe, killed millions of people in Europe during the Middle Ages. But now with new medical technology, scientists are saying you can easily cure this illness with antibiotics, they're saying. It says here the reason why it hasn't been eliminated is because there's an animal reservoir. The bacteria can affect animals, and because we can't treat all animals in the wild, it persists in nature and thus occasionally causes a limited number of human cases. It says CNN reporting about 7 human plague cases are reported each year in the United States, primarily in rural Southwest and Northwest areas, according to CDC. Plague is caused by the bacteria, kind of bacteria. Humans usually get it after being bitten by a flea or infected by an animal, and symptoms are typically showing up 2 to 8 days later. They include painful swollen lymph nodes, fever, headache, chills, and weakness. Well, that sounds like a lot of different kinds of sickness. And if you're like my family, we don't go to the doctor when we have those symptoms. So who knows if I've ever had the plague. If I get sick like that, I get fever, I just hunker down in the house and do some holistic remedies and get better. So I may have had plague before, not known it, but I don't think the plague scare is a big deal. I know every time we see a headline like that, it kind of causes like a PTSD response for so many people affected by the pandemic. But I think the bubonic plague headline is a big nothing. Let me know your thoughts in the comments. So, what do you think is causing this jump in cancer? I'm going to link down in my description a podcast I did with a top doctor on what really causes cancer and how easy it is to cure it. These are simple scientific studies that are being buried. The truth about cancer is going to be down in my description if you want to check it out. It's on my health and fitness YouTube. I'm going to be doing a lot more health and fitness videos going forward. Health, fitness, and mental health. So you can subscribe to that other YouTube channel down below. We'll see you guys next time.